Does your child really need their cholesterol checked at the age of 9? The short answer is yes. I'm Dr. Alta Peter. I'm board certified in pediatric GI and obesity medicine. Here's the deal. Both the American Academy of Pediatrics and the American Heart Association do recommend a single screening test for cholesterol for children sometime between the ages of 9 and 11. A lot of times this takes families by surprise because we are all accustomed to thinking about high cholesterol as being a disease that affects people in their middle age and later. But here's the truth. We know that the process of atherosclerosis, meaning when cholesterol gets deposited into the arteries in the heart and elsewhere in the body, causes that hardening of the arteries that leads to heart attack and other complications. It doesn't just start in your 40s. It's actually happening even in childhood. It's a slow, progressive process that happens more significantly in people who have high cholesterol. The really important part, though, is that about 1 in 250 people have a genetic mutation that leads to what's called heterozygous familial hypercholesterolemia. And these are the kids that we're trying to catch with this screening. So high cholesterol is generally a completely silent condition. It's not causing any symptoms or problems, and you wouldn't know to look for it. And so that's the reason that we're doing this screening test. So if we identify kids that actually have this mutation and have sky-high levels of cholesterol when they're young, we know that they're at a very high risk of premature heart disease. And there's something we can do about it. Effectively treating that high cholesterol can make a huge difference in long-term outcomes by reducing the risk of heart attack, stroke, and early cardiovascular death. So no, your pediatrician hasn't lost their mind. They're asking you to do this because it's a very reasonable and evidence-based strategy to help capture these patients early so that we can intervene appropriately. I hope this is helpful. If you have other questions, please drop them in the comments below.